Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Yeah, it's good to be back. It's we've been doing it for a few years now, so it's
I know. It's our
part of our
weekly
routine.
thing.
Yeah, exactly.
I look
Exactly.
forward to it every week.
Me too.
Well, today I wanted to talk about something in my realm of infectious diseases. There is an outbreak of pertussis, which a lot of people know as whooping cough, made because you get this whoop or sound as you're coughing so hard and then you're trying to get a inhalation of breath. This is a vaccine preventable disease and it can be fatal, especially in infants. And we're seeing an outbreak of these cases.
Yeah, it's interesting. I'm glad you raised it. First of all, I remember learning about whooping cough in medical school and Bordetella pertussis and all of those
Hmm.
sorts of things, but we didn't really, when I did my internal medicine and my clinical rounds as a med student, we didn't really see it, and that's
No.
because it was very low prevalence because of vaccines. So this sounds like this is another one of these infectious pathogens that's kind of back on the rise.
Yeah.
Again, because it's vaccine preventable, but there's just not enough people getting vaccinated, I think, right?
Yeah, that's really the problem because the vaccine's quite good. It's not 100%, but it's about 97% efficacious in preventing infection. Obviously, if you're in an area with a high outbreak, you may want to still avoid infected people, but getting the vaccine prevents cases. But now we're seeing with pertussis, there have been, according to the CDC, almost 4,000 cases just from September 21st to October 19th. So our case count is almost 20,000 for the year. Last year it was only 4,358 cases. So this is a significant increase. It's mostly seen in Pennsylvania, New York, and Illinois, but other states have been involved. And again, it comes back to people not getting vaccinated for a whole host of reasons.
Yeah. And yeah, you're right. And we could talk about that too. But I think number one is just for people I think we sort of lose track, uh, all of us, because we're now at generations removed from these being diseases that are common. And so we tend to think of them as not, well, it's not that, and we tend to not think about infectious diseases as quite as bad as maybe they were in the past, or a scourge of society. And whooping cough might be one of those, right? So if you make a cough, I've had a cough many times. Why would I need to worry about getting whooping cough, right?
Yeah. Yeah, and let's talk a little bit about that. So it is
Yeah.
true if someone who's otherwise a healthy adult gets whooping cough, uh, it could just be a low-grade fever and this annoying, persistent cough. But the cough can be so bad that it could actually lead to vomiting and exhaustion, and then it will last for quite some time. So you could have this annoying cough that takes weeks to months to resolve. So that's for a typical healthy person. But in someone who has underlying respiratory conditions or infants under the age of 12 months, they can die from this. They can cough so hard, they can have apnea, so not being able to breathe, encephalopathy due to the hypoxia from not enough oxygen getting to their brain because of the coughing or the toxin that the bacterium Bordetella pertussis produces. They can get pneumothorax from coughing so hard, rectal prolapse, rib fracture, seizures. They could even die. So it's not a benign disease. We have a good, safe vaccine for it that people have been getting for a very long time. We have so many decades and decades of safety information. So it's one of those things that we just need to keep promoting and make sure that we're getting accurate information out there to counter the misinformation that unfortunately is present.
Yeah, and that is part of it. I mean, that's part of the milieu that's leading to some of these things, these diseases kind of making a comeback, if you will, that have been on the wane because of good vaccination. I think measles is another one that has
Mhm.
also been on the rise, if I'm not mistaken.
Yeah, and Dr. Binniger and I talked about that a little while back, so that's available for anyone who wants to listen to it. There have been 15 outbreaks of measles so far this year. There were only 4 last year, and 40% of the cases were hospitalized for a number of reasons. Measles is another one that could be deadly. Actually, it's probably worse in terms of mortality compared to pertussis. Not something you want to mess around with.
Yeah, exactly. And they can be what measles, as I recall, and we won't have to do it. Go again. Dr. Binnicker is the expert, but that's when you can even get this, the kind of the subacute encephalitis, which is untreatable and can be fatal, and all those sorts of things. So these
Yeah.
are, and we forget. I think one thing that for people to keep in mind too, we always talk about the role of the laboratory, is it's, we need to maintain vigilance and understanding this, not just because of the whole topic around vaccination. We can get into that a little bit more, but also around testing, because what happens
Mhm.
is when diseases aren't as common, practitioners might not be thinking about these in their differential diagnosis. So letting them know that these tests are available. How much is someone thinking about whooping cough in an adult that just comes in and complains of kind of chronic cough, right? And some of these things. And so, yeah, that's the other thing, is to really make sure that we're paying attention to what's happening, so we can really promote the good use of testing. Because again, testing is another way of disease control, right? Once you identify
Mhm.
patients, you can isolate and do other things.
Yeah, that's especially true for measles, which is probably the most infectious disease in the world, at least in the top five. You need to identify measles and then isolate that person and make sure that they're not getting exposed to other people because it travels by the airborne route. So it's little microscopic particles going through the air. Most testing would be at the state health departments or through the CDC. Large reference labs like ours through Mayo Clinic Labs, we also offer testing. We have serologic testing to show evidence of past vaccination or infection, but we also, through Dr. Binninger, recently created a measles PCR test to detect acute disease. And I think in the laboratory, we're natural educators. It makes sense for us to talk to our colleagues and make sure that they're aware that we have these testing options because we're part of the care team and that they need to remain vigilant to think about ordering the tests. We need to make sure we have the testing options or can send out the tests as needed.
Yeah, no, that very well said. That's probably, you
Mhm,
could say that for everything you say, but no, it's true, right? And maintaining that and understanding that. But when you're talking about measles and how contagious it is, it's hard to talk about the stuff and not think back to COVID, right? And
mhm,
there was, of course, a lot is COVID. That means it's truly aerosolized with measles, and I think that's one of the case studies was even like on airplanes, which was another big focus for
mhm,
COVID. And of course, we can't talk about the whole concept of vaccination without thinking about COVID, what's happened. Again, a lot of people didn't get routine care during COVID, including kids. So that means people just fell behind on their vaccination schedules. I think, unfortunately, the COVID vaccine itself generated a lot of confusion, mistrust. There was some mistrust and misinformation. There's no doubt. And then also because, the hope with the COVID vaccine was that it would be so effective that it would really knock out the spread. It probably didn't as much as people had hoped, but certainly helped prevent people from getting seriously ill. But when you step back and these other diseases that we're talking about, things like measles, things like pertussis, whooping cough. I mean, a big part of vaccination, and polio is another one that we've
mhm,
seen this too, right? It's not just for you, right? At some point, but a lot of these vaccines that are really effective at suppressing the spread of the illness actually help by you getting vaccinated. It doesn't just help you, but it actually helps prevent someone who's going to get seriously ill from the disease from getting exposed. I mean, that's the real, and we know these. The reason that these diseases are making a comeback is because the vaccines were actually effective at preventing the spread. So when we start to think back about just making informed choices as individuals and us as a medical community helping with those choices, is to really think about the overall goal of vaccinations and not to let it got so enmeshed in a lot of other things. But it's really tragic to think about, if someone dies from measles, I mean, how terrible is that when it's just
Yeah.
totally preventable, right?
So horrible. You bring up a really good point too. It's to protect you, but it's to protect everyone around you, all your loved ones, your family, your community members. And usually there's a target of 95% or above vaccination coverage, which is then protective for the community. And worryingly, the MMR, measles, mumps, rubella vaccine, the coverage among kindergartners is now below the 95% goal for kindergartners in the United States. And in some pockets, it's even lower. And it looks like the rates are decreasing. So this is a perfect time to make sure now that COVID, it's now become a seasonal respiratory virus, but it's not stopping us from going to the doctor, getting our vaccines. So bring your children, make sure your family members are vaccinated. And then, of course, this is the time to also think about your annual vaccines, influenza, COVID, and RSV if you're in one of those risk groups.
Yep, exactly. And the other thing we can't lose sight of too is, we saw this with some of the COVID vaccines that went out of date. This is another area for all of us to be invested in global health equity, right?
Mm-hmm.
Because there's a lot of parts of the world that people would love to have these vaccines, and public health would love to have them available, and they just don't have them available, right? And when we don't, but that's, again, smallpox is the example of something that we actually kind of drove into extinction, although there's even
Mm-hmm.
concerns that there are some animal reservoirs out there for that. But that's when we have to really think about kind of global health. What's our responsibility? How we're all interconnected as a human society travels back up to beyond probably where it was pre-COVID. We are truly a global society. So we have to really be thinking about these issues, not just for ourselves and not just for our own citizenry, but also on the global scale as well.
Absolutely, Bill. Couldn't have said it better myself.
All right.
Well, as always, great to talk to you about this important topic.
Yeah, of course. Yeah. And hopefully people will get out there, take measures to keep themselves safe, and stay up to date on your vaccinations and all those things that help keep us all healthy. So,
Absolutely. Go out, get your flu vaccine and your COVID vaccine. Now is the time. It's the perfect time to do it.
but if you're unlucky enough to catch it, talk to your trusted laboratory professional about getting the right test.
Absolutely. Great point. Thanks, Bill. Talk to you next week.
I look forward to it.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.